very, very happy to have Jane Peterson with me this evening, who is been a great sport, agreeing to talk to us about caring for other people. And it's something that I think we're only ever going to be faced with more as our parents get older, as we have more care in the community and try to keep people independent. And mouth care is one of those things that is so important, yet often neglected, because people are either scared or they're not sure what to do, or they just don't want to get involved. So I'm going to ask Jane to introduce herself and tell us a little bit about her background and how she got into this aspect of oral care. So please share with us, Jane, your background and experience, please.
Okay. Hi. So I'm Jane. I'm a dental hygienist, and I set up a company called Knowledge Oral Healthcare. And what we do is we go into care homes. It started off, we go into care homes and we were providing an oral care service. So that meant brushing teeth and cleaning dentures. What we primarily do now is just training the carers. So how that all came about, just very, I'm just going to brief you. I'm not going to talk too long about it, but I was collecting information for a study I was carrying out. I wanted to find out the carer's perception of brushing teeth. I had a patient who had owned 2 care homes, a nursing and a residential home, and I decided I was going to interview the care staff, which is what I did. And I was quite surprised actually to find that there was no mandatory oral care training. This is back in 2015. They don't like brushing the teeth. Lots of the carers have poor oral health themselves. They found it quite challenging. They didn't have the assistance or support from the dental profession. CQC definitely wasn't put on the oral care wasn't put on the CQC list back in 2015. So it definitely wasn't being prioritised either. So I decided that I was going to screen the residents, obviously with consent. Mm-hmm. And that's what I did, got the consent forms. And what that was, I mean, it's mandatory now, but all I did was literally shine a torch pen in people's mouths. And I wanted to look at the level of the state of their mouths, I suppose. So that's what I did. But I was quite, Lee, I was quite horrified at the amount of broken teeth that I saw, dentures, particularly, lots of decay. The amount of dentures that have been in the mouths for, we're not even talking months here, we're talking longer than months, where staff didn't even realise that that resident that was admitted, that they'd even had a denture. And the state of the mouths was quite poor. Not in every single person, but quite a lot.
Yeah.
So with that, I had this kind of burning desire, if you like, to set up an oral care service. So what I did was literally brush teeth and clean dentures. And from there, I went round I gave talks at hygiene study groups and meetings and things, and got like-minded hygienists into care homes. I mean, we started giving free oral care training because at the end of the day, it's knowledge, isn't it? If you know why you're doing something. So we were given these free training sessions, and I kid you not, either the phone was put down on me from care managers or whatever, or if, you know, lots of managers said no, because it wasn't mandatory, you see. And then when we did get our foot in the door for free training, quite often it was poorly attended. But anyway, yeah, so it's been quite hard work, but let's just, if I can go to providing mouth care for people that you care for. So a massive learning curve for me was when I started what I thought was a really simple, easy thing to do, delivering mouth care. You know, it's brushing teeth. I mean, how straightforward can that be? Yeah. Massive learning curve, because it's not as straightforward as you think. Having a toothbrush and brushing someone's teeth is quite an alien thing. It's not a natural thing. It's quite an alien feel to it.
From somebody else.
Yeah, I mean, I'm sure you've done it yourself, brushing someone else's teeth. And the other thing that was a massive learning curve was the amount of people that were resisting mouth care. So now, being in practice, you've got all your patients make appointments. They're all compliant, aren't they? They make appointments and they come and see you. They're lying there with their mouths open. We'll go into a care home when you're approaching someone with a toothbrush and they don't understand, or they're being resistant or aggressive, or whatever the case may be. So that was something I wasn't prepared for, or the amount of it anyway. So in any one care home, they reckon on average you've got about 70% of residents with varying degrees or levels of dementia. And as people advance with dementia, they tend to become more resistant to mouth care. Yeah. So we put all of that, a lot of that aspect in our training, tips and coping strategies, are experiences and things that because there weren't any sort of courses particularly.
Yeah, there was nothing to actually give you direction at that point.
Yeah, it's more about dementia now, but so we sort of go into care homes more with support.
How long ago was that?
2015.
How long ago was that? Right, so yeah, at that point it really wasn't, well, it wasn't a dumb thing.
Yeah, well, it's not that long ago, but in 2000 only in 2000, was it July 2016, the best practice NICE guidelines came out, and then in June 2017 that all the mandatory stuff came about. It was quite funny because I was phoning these care homes saying, oh, did you know about best practice? And they thought I was making it all up. I was like, how did they know
really?
that stuff? But yeah, I mean, 18 months ago, it was longer than that now. The CQC randomly went into 100 care homes, and they interviewed care staff, care managers, next of kin residents about mouth care, and that was all obviously published in June 2019. So it sort of came out and announced sort of more so in the media. And they put since October 2018, they've put oral care training, or two mandatory questions anyway, on the Chloe effective list for the CQC. So it's becoming more.
Yeah, it's because and ultimately we've got an aging population who are retaining their teeth, and they're not the only. Would you go into residential care where it's not elderly? Would you go in?
Yeah, we do. Yeah, we do learning disabilities.
Yeah.
So we have two completely two separate. Are you talking about the training or the oral care service?
No,
now?
both.
Okay. We haven't been asked. With learning disabilities, they tend to be smaller. They tend to they know their clients. The residents for the elderly, there's quite a high turnover. I mean, on average, people are in a care home for about 5 years on average. For learning disabilities, they tend to be small houses. There's a few of them. They know their clients or service users, whatever they name them. So there isn't, but the training aspect, definitely there's a need. So we've got two different presentations. So for the elderly, it's very much about lowering the bacteria levels. For the what did I say for the elderly? For the learning disabilities, it's very much about the same sort of thing, but we home in more on alternate sugars and go into decay
and more of the whole health messages. I mean, if any of you have not gone and looked at Jane's website, it's Knowledge Oral Healthcare. It is a font of information, and there's tips and hints there. There's links. There's all sorts of stuff. And I attended one of her training sessions one evening, which was full of speech and language therapists and all sorts of other people and muggins in the middle of it all. But it was fascinating. And I've worked in the community. I've worked in hospital care, and still there's something else to learn. So if you are interested, if you have a responsibility for oral health or personal hygiene, personal care in any of these settings, please go and have a look at what Jane's doing, because it is very unique and it's incredibly effective at getting results, because ultimately it's the one thing that people can do for somebody else. I know when my mother-in-law was in residential care, the staff didn't know that she had a partial denture. And their idea of putting their fingers in her mouth was an absolute terror, they'll put, I mean, I find carers will put their hands in every other orifice, but not,
I know, I find it quite incredible too. But
yeah,
they'd rather do the that end than that end. It just
yeah,
doesn't kind of, yeah.
yeah. So
But
it is strange. Now, having said that, I'm going to ask you some questions. And some of these you may have been warned about, some you may not. So just tell me to mind my own business. But ultimately, why is it so important for people in care and residential care to have mouse care? Why is it a big deal? You know, there's some people would say they're old, they're gonna, you know.
that's this is part of the problem. So a lot of the care staff or carers don't know the importance of mouth care. I mean, it's been quite a bit, there's been a lot of literature around with how poor oral health affects the body. So people quite often come into care homes with existing problems. So they've been living at home, you know, on their own, they've been neglecting their personal care, etc. And then they come in, so they've come in with problems. So the importance of mouth care is for the elderly, now we're talking about, is lowering the bacteria level. So and I usually, as you saw in my presentation, we start with the heart because that's kind of where it all started. But what the experts believe that they don't really know precisely, but they believe that if the mouth is inflamed, got bacteria in the mouth, the gums are inflamed, the bacteria goes through the gums and floats around the body. Now, if you have damage somewhere in your body, the bacteria will migrate to that area to cause further damage. That's the thinking behind it. Yeah, so it kind of all, like I say, it all started with the heart.
And it's not just the heart, is it? I mean,
no.
There's so many other things that are connected with your oral health.
Massive list. And the latest one is poor oral health and dementia. So there's lots of, we were following the NHS dementia research team around a couple of years ago, or it's probably about 3 years ago now. So they look at brain tissue, people with dementia, those without dementia, and those with dementia, they've got this, what's called Porphyromonas gingivalis bacteria that is in the mouth, and it was in brain tissue. And what they believe is the bacteria is floating around the body. When it gets to the brain, it causes inflammation of the brain and kills off brain cells. I mean, that's the thinking behind it, but there's constant research going on.
I think that's a real eye-opener for people my generation who are going to be the next sort of level of people eventually requiring residential care, because the thought of having the sort of control to try and reduce my risk of dementia purely by looking after my mouth better, it's a great motivator in itself, you know.
But also, Leigh, it's also the sense of well-being. Yeah. And unfortunately with the mouth, it's hidden, isn't it? So if mouth care isn't carried out, no one sort of goes along and checks. And I'll give you a prime example of that. So when I was in, you know, the care homes, so I had 14 homes, and I used to visit them once a month because that was the service that I had, and it was really to be a support to the staff, you see. So I would you know, brush and clean people's teeth, and then I turn up a month later, and some of these residents, they had a month's worth of plaque on their mouths, you know, in them, and you know, but and we were talking about this off air, if you like, about the turnover of staff, which is really high, and even more so now the turnover is higher than it's ever been before. So you're never really talking to the same people. And care managers, it's the turnover of care managers is the same. So you're kind of not talking to the same people, and that is a bit of a problem, unfortunately.
Do you think there's an opportunity there for family members?
Yeah. So, I mean, okay, it's all gone a bit kaput at the moment, but quite often,
the end of the tunnel.
Yeah, but quite often you have, you know, the relative, it could be a friend, but quite often it's a daughter, I'll be honest with you, where knows that the mother or father isn't getting mouth care. They don't like to complain, so they end up doing it themselves. And I came across that yeah, quite a bit actually. You'd be surprised. And so the you know, that family member will be going in. My mum has got dementia. She's in a dementia care home, and I was delivering mouth care, despite going on and on at them about mouth care.
So how do you approach that, as from the point of view of I'm a carer and I've got a parent in a home and I want to do something, because I know when Margaret was in residential care, you went in, often you had the same conversation, and you know, you ran out of things. Is there anything you need? Is there anything I can do for you? But my mind has always been, I did do her mouth care, but you know, how would you start encouraging a family member to actually take that on board? What could they do? How do they do it? Is there anything...
with regards to the home, you mean?
Yeah, yes. So I'm going to visit my mother in residential care. I would love to be able to help and do something. She's not cleaning her teeth the way she used to. Can I help her? How do I go about helping her?
Well, I mean, before this all took place, you just literally, all that happens is you go in and you know, just start brushing your parents' teeth or whatever. But with regards to the care home, if you want to and stick your hand up and say something, it's a lot easier now, because it's been put on the CQC list. So mouth care has become a thing where, you know, not so long ago it wasn't. So it is a bit easier. And so basically the care managers are more likely to go, okay, we need to be doing something.
Yeah.
So also on the care plans, everything else was put on there, you know, what they had to eat, the fluids, you know, everything, bathing, etc. But mouth care wasn't. So the sort of things that are put on, the mandatory things that are on the CQC list, are really simple stuff, and it's lit things like just ticking in the morning that the teeth have been brushed or not, you know, and they've been brushed or not in the evening. So just simple things like that weren't included. So they people should find it. Yeah,
Could be happening
to do that, definitely, hopefully.
So when you're, I mean, say I want to brush somebody else's teeth, my automatic reaction is to work from behind, because
I do
it. So would that be the easiest way, or am I better going up from the front, or am I better going hand on hand, or does it depend on how well the individual is? And you know, do you have to have, I'm assuming you have different approaches for different scenarios.
So I'm going to give you my experience, okay, because we talk about this as well. So for a child it's a bit different, but for an adult, if you are, first of all, if you're brushing someone else's teeth, is to get them to sit down if you can, because it's very difficult to brush someone's teeth if they're standing up. Exactly. So, and the other thing is to approach them from in front, and brush their teeth from the side, because because it is backbreaking basically to brush someone's teeth face on face. Although it seems like a really natural thing to do, to approach someone and brush them face on face. Actually, if you look at the COVID guidelines for mouth care, if you know they've got COVID, you're supposed to stand behind them, but it seems like a natural thing to do, to stand in front of them, but to stand to the side, so you've got much better support and visibility.
You end up at that because their knees are in front of you and you're going like this.
Yeah, it can be backbreaking.
And do you have products that you would generally recommend, or there things that are more readily accepted? Say, you know, if you've somebody, of course, it's maybe limited fluids or something like that you have to be careful, because you had a great gadget the other day. I was really taken by
I was going to have a chat with you about that, actually.
So seriously impressive.
Yeah, we've got a recommended products page, and that's just products we recommend. So basically when the sponge swabs were being advised not to be used.
Please, everybody, listen to this. Sponge swabs do not clean teeth.
Okay? Oh, well,
they're dangerous. They should not be seen.
So basically in Wales they've been banned, but in England they're on a medical device alerts, so they can be used with caution, but don't use them, basically.
And they don't actually use these anyway.
Yeah, there's a bit of controversy going on earlier about whether you could use green swabs because they're not glued on, they're heat bonded, but no. So what happens when people were saying to me, carers were saying, well, what other product can we use then instead? So we do have recommended products that you can use. So you've got Mouthies, for example, although again, that doesn't clean teeth, it removes dried mucus secretions from the oral cavity. But yeah, we've got products, but the one that you're talking about, Leigh, is so we've got for nurses and carers, a lot of people, for people with dementia, as they advance in the later stages of dementia, quite often they end up with swallow problems. And when they have difficulty swallowing, it's quite scary. It can be quite scary with delivering mouth care. I mean, I've delivered mouth care on people that are nil by mouth, which again is really quite scary as well. So there's always that, risk of inhaling and swallowing, and choking, etc. So I'm always been asked, not always, but been asked about a suction toothbrush, which there is a manual pump one. It's about over £300. It doesn't really, it's not fantastic, I've been told. So, and then there's a brush that is attached to a suction unit, which is the one which you'll find in hospital, but you won't find anywhere else. So I came across an electric suction toothbrush, which I thought, oh great, which you can only buy in America. There isn't anywhere distributing them in the UK. So I basically contacted the manufacturers, and so we've got to supply them. We sold out. We've got so I did a little demo. I don't know if you saw the video.
I did. That was what caught my eye. I thought, wow.
Really excited. And I tell you why I'm really excited about that as well is the suction's really good on it, but it's got a light that shines, which is fantastic. I'm always going on to carers about when you look in the mouth, get a torch pen because they just look in their mouth is such a dark place. So to have an electric toothbrush with a light, the vibrations, it's 1400 vibrations per minute, which is actually quite low. The bristles are very, very soft.
Good.
Doesn't actually feel like it's doing that much, but you kind of need it for people with neurodisability and people that are quite sensitive with vibrations. So very excited about that.
I have to say, I was really excited about that, and I thought that makes sense. And I still am quite surprised how many people will look for every alternative to clean teeth apart from a toothbrush. And they don't realize it's just that mechanical disruption of the plaque that actually is that biofilm breakdown that's important.
Yeah, so that is an important topic you've just brought up, actually, Leigh, because the other thing is when people have got they can't swallow, you can use a toothbrush and just dab it with a bit of mouthwash or water. It doesn't, or even a dry toothbrush. It doesn't necessarily have to have toothpaste on it. So, or if you are going to put a smear of toothpaste, then just have something which is, non-foaming or low foaming toothpaste, definitely.
Yeah, no, it's quite interesting that, because I think over the years, I mean, it's like anybody, you don't have to be in residential care. I mean, a number of times I come across people who just would rather use a mouthwash than clean in between their teeth, and shortcuts for everything instead of that actual boring, monotonous toothbrush bristles on the gum line every surface of each tooth. So yeah, I think that power toothbrush with the suction is really exciting, and I've experience of the hospital ones that are attached to the suction lines, but they're, I mean, the brush itself is fine, but they're ridiculously expensive for what they actually are, and their efficacy's, I think, a bit questionable. That dates me terribly. How do you know? I'm going to ask, this is a slightly awkward one, maybe. Somebody who has dementia or memory issues or learning disabilities and communication issues, how do you advise people to check their mouths and recognize if they're in pain? I mean, would it be just that they're not eating, and or they're touching their face?
This is a part of it's mandatory now. This is part of the these oral health assessments. But if depending if it's in a care home, then they need to be doing their routine oral health assessments, which is looking in the mouth. But if you're at home, for example, and someone's stopped eating, quite often what we've found is if somebody has stopped eating, which is or their behaviour is a bit different, or they're having they're drooling a lot, and it's always have a look in the mouth. And if somebody's losing weight, actually usually the last thing people think about is actually looking in the mouth. Now, quite often when we got telephone calls for people with oral pain, and quite often it was where a tooth had broken and it was rubbing on the soft tissues of the oral cavity, and yourself, how painful an ulcer can be. And some of these, and what I say to people now is, look at the soft tissues before you even look at the teeth, even, because almost for the elderly, almost 9 times out of 10, it's a really, really painful ulcer that's in the mouth. So I, check the mouth and look for soft tissues. But if you've got somebody with, with mental disability, such as learning disabilities or people with dementia, you've got that whole aspect of people that are resisting mouth care or declining for whatever reason. Now, so I can go into that whole topic for you.
Because I think that is,
if you like,
important, because often what happens is I speak to people and they say, mum or granny or whoever would let me clean, and now they won't, and it ends up a fight, so it just doesn't happen.
Right. I'm quite happy to go into all of that for you.
Please do.
So this is one of the things, like I've just said right at the start, is the amount of people that resist mouth care. So, for all different reasons. But that's what makes mouth care quite challenging. And we go through, there are different tips and coping strategies. But if somebody is resisting mouth care, sometimes you don't know why they're resisting. Are they in pain? Is it they just don't want to have their mouth cleaned? Or what we always say is try and keep them as independent as possible, so that they've got as much control as they can, if they can brush their teeth. So the NHS Scotland's tips and coping strategies are chaining and bridging. So giving that person a toothbrush, you're holding a toothbrush and you're doing follow my leader. So they're mimicking you. It's quite a good one. It's something that people don't think of. Not always. The other one is you're holding the toothbrush and you've got your hand over theirs and you're guiding. So it's giving them that control. You've got the distraction technique, where you're giving them something to hold. And then use brush. That's quite a common one. It could be that you just need a different approach, or somebody different to come in and brush teeth. They may not be receptive to you, so that may be one. One that works for me, I mean, there's lots, and I'll go through them one by one in 2 secs, because I've got my list of things that I'll go through with you. But one that works quite nicely for me is one by Teepa Snow. She's a kind of a dementia expert, and it was all on Twitter fairly recently about one of her techniques, which I quite like. So what it is you get that person to hold a toothbrush, so they've got the control. You've got your hand over theirs. It's a hand on shoulder distraction technique. Okay, so with you're bringing their hand towards you, so hopefully they're opening their mouth. With the other hand, you've got you're pinching the top of their shoulder. That is the distraction, by the way, not too hard. So you're bringing the hand up and you're squeezing their shoulder, so that's the hand on shoulder distraction technique. It's the distraction that's actually working.
They're focusing on this while you're able to help them.
But they're holding, they've got the control, and you're giving them the distraction.
Brilliant.
So anyway, that works quite nicely for me. I mean, mouth care is quite straightforward. I mean, provided you've got the tools, you've got a nice small toothbrush, preferably small, soft. So if you've got somebody resisting, it could just be that the gums are inflamed and the gums are tender. So we always say small-headed toothbrush. You're going to get further to the back. You're going to get areas less likely to gag. Make sure it's soft, and run it under warm water. Make it even softer, because if you go in with even a medium brush, it can be a little bit tender for somebody. Okay, so things like that. Then doing, as you know, when you're brushing somebody else's teeth, it could just be that if you've got somebody that's resistant, that you only brush one side in the morning. All right, you brush the other side in the evening. That's maybe that's all that you can do. People stress out about brushing the whole mouth, but you break it down into sections.
And would you suggest that if you're doing it like that in halves or quadrants, that you try and remember to start in a different place the next day? So
well, yeah, I mean, if it was in a home, it would be noted. Yeah. And so that the other person, the other carer in the evening would know what's happened, etc. Obviously, if you're at home, providing mouth care, then you'll have to leave it up to yourself to or write it down as to what section you're going on to the next time. Or, it could just be the fronts of the teeth get brushed and the backs of the teeth get brushed another time, whatever that is. But what you're trying to do is hopefully build up a tolerance to toothbrushing, so it becomes more regular. So it depends. I mean, if somebody is particularly aggressive, and I've come across it where I've nearly been hit.
How aggressive is aggressive?
Trying to hit me, or carer, So again, each person is different, but the problem with dementia is, as people advance, they don't know why you're approaching them. You see, this is the problem. And there isn't one tip, there wasn't one technique or tip that suits all, unfortunately. It's a bit trial and error and getting to know that person. But if you've got somebody that is that aggressive, forget it. I mean, you just need to back off and approach another time. The other thing I would say is, mouth care doesn't have to be done first thing in the morning. Okay, if morning isn't the best time for that person, there's a couple of homes that I used to go to which were advanced dementia. I wouldn't dream of going there before about 10, half 10, once they'd had their medication and breakfast. So it doesn't necessarily have to be done first thing in the morning. The other thing I would like to say with people with dementia is you might want to separate the personal care. So doing washing and the toothbrushing together may be too much for that person. So you may want to separate the personal care.
That's a really good tip to know, because I think people tend to think of personal hygiene and doing it all at one time, getting it done with and marking that off as done. So that separating that out is a really useful tip. And doing it at a different time in the day. I often suggest that with children who are very fractious about having their teeth brushed, don't get bogged down with last thing at night and in the morning. That's an ideal scenario.
You know what, Leigh? It's very much about being realistic. It's being realistic. It really is. You've got the other thing I would say is it's the whole two things I get that the staff get a bit, or carers get concerned about, is hurting somebody. Okay, so when you're delivering mouth care, they think they're going to cause trauma. It's very difficult to traumatize someone else's teeth, gums, if you like, or cause trauma, to apply too much pressure. For yourself, if you're brushing and causing recession, you can, but to actually traumatize, press too hard when you're delivering mouth care is quite, it's probably unlikely. The other thing is with regards to timing, to the 2-minute timing. For you and I, yes, we need to brush our teeth for 2 minutes. It's recommended. That's what we do. If you're providing mouth care for somebody that is resisting, 2 minutes is a long time. I have not.
A long time for anybody, isn't it?
for someone with dementia, I've never been able to actually provide mouth care for a whole 2 minutes. I mean, dementia is my sort of speciality, if you like. But yeah, so it literally is a matter of removing as much plaque as quickly as you can. And in some instances, the other thing I would say with regards to brushing technique, yes, you know, remove the plaque away from the gum margins. Obviously, that's where the plaque sits around the neck of the teeth. But with regards to brushing technique, okay, do whatever you've been advised to do by your, you know, dental professional. But when it comes to brushing someone else's teeth, that kind of goes out the window a bit again, to be honest. So you just got to remove the plaque, whether that's in a circular movement backwards and forwards.
Something's better than nothing. Electric toothbrush, manual toothbrush.
Well, if they can tolerate an electric toothbrush, not everyone can, depending on whether they can tolerate the vibrations. But yeah, sure, an electric toothbrush is
and I was
does
just
everything for you.
These ones, the little Dr. Barman's,
yeah,
which because they can be quite handy because you can get quite a lot done in a short space of time with those. I find they're quite handy. And
yeah, we recommend those. Actually, I don't know why I say, but more for learning disabilities, we recommend the.
I was always a big fan of these for people with Down syndrome because they've got that movement, but they don't have that. They're quite good at scrubbing, and that was where I used to be. You know, really got into the Dr. Barman's type, that so triple-headed brush, and there is actually an electric version of that, but it's. Somebody sent me one and I never really got that taken with it. It was actually battery operated, and I think that was what put me off slightly with it. You know, anything, isn't it? Are they better with a non-foaming toothpaste?
Yeah, there's well, I mean, there's toothpaste on the market that you can get, you know, like things like Sensodyne and that non-foaming. I mean, what I would say though is anyone that's got a dry mouth, please don't use a whitening toothpaste because that will dry the mouth out even more. So just would like to mention that.
That's a really good tip because people don't realize that. Yeah, I'm going to throw another one at you. Pineapple.
Okay. You're going into palliative care. Yeah. Right. Okay. So
it's just because you mentioned the whitening, I thought, oh yes, I know another thing that's it's a bit controversial.
So when we were going into hospice, I was quite surprised at pineapples were used. I was like, oh, why? And it was so I kind of looked into it a bit more, and because it was all kind of a bit new to me, I suppose. And I got chatting to a chap that was doing a study on it at Bristol University at the time. But pineapples are used to break down stringy saliva. That's why they're used. But the thing is, they're full of sugar. I mean, so forget the acidity in it and the demineralizing the enamel and all that aspect of it. What it does is it over exacerbates the salivary glands. So what it does is it dries the mouth out. So pineapple cubes are used in palliative care. So we don't actually advise pineapple cubes at all.
But it is something that, because I actually had a patient recently whose medical team had recommended they use fresh pineapple chunks, and I'm thinking, why? And that was why I just thought I wanted to hear, because I knew you had experience with them, and just because it's something to do with the enzyme that breaks down that.
Yeah, think about it. I mean, palliative care is about keeping somebody hydrated and comfortable. You know, mouth care. I mean, if you read the problem, there aren't guidelines. Well, the nice palliative mouth care management guidelines were revised in October 2018. And they're quite extensive, but other than that, you look up at things and there's all sorts of different bits and pieces out there. So yeah. But so if you look at somebody that's unconscious and conscious, and it says to go back 1 to 2 hours unconscious, and 4 to 6 hours if someone is conscious, But that's not necessarily running backwards and forwards to brushing people's teeth every 1 to 2 hours. That really is ensuring that somebody is hydrated and comfortable. And the other thing is, when somebody is in palliative care, quite often they're lying there with their mouths open. So they get these secretions on their palate, which, if I'm allowed to say it, it's dried snot, basically. So that it's really, you know, it's green, sticky stuff in the palate. So it's a matter of removing that, which is where these, you know, tools come into play with the MC3 sticks. You know,
and even the little. Have you got the Orally 360?
Yeah, the 360 toothbrush.
I really like that for applying dry mouth gels and things. So I think you can massage that. Yeah, you've got the.
So there. Oh, hold on. Let's just get this up. Oh no, hold on. Let's just get this one up. So that's what we call an MC3 stick, and it's rubber. So that's not for cleaning, brushing the teeth. It's just literally for removing the secretions on the soft tissues, the tongue, the cheek, palate, etc. But this fantastic little gadget, love this to pieces. Inexpensive. Oh, you got on, there you go. Inexpensive, don't need to discard it. Brushes, it's a toothbrush 360. So you can brush the teeth with it, but fantastic also for removing the secretions from the soft tissues, the tongue, the cheek. So it's one size does all type of thing.
I think they're
orally. Oh, do you sell them as well, do you?
Yeah, we've got them on the online shop. I mean, if I have found somebody like yourself who's an expert in the field is struggling to get a product or you know, a personal experience of it, we're happy to keep it in the online shop, because that was never a part of the original plan with Growing Smiles. I mean, the fact that we were buying stuff for clients, and then somebody said, well, why do you not just make them available online? So anything that anyone will find on the online shop is that we have personal experience of, or we have very strongly recommended by somebody who we respect as an expert clinician or, you know, researcher or whatever in that field. And I know I've upset a few people by saying no, but conversely, things, particularly dry mouth things that are not always easily found in the high street here,
yeah, and you know, when we're going into homes and we're giving, you know, these this training, that what people turn around and say is, well, what do you recommend then? Well, what should we use? What, you know, don't use this. What should we use? And that's how really it came about for us, I suppose. But we don't have thousands of products, and it just links you to the company that sells the product.
I think it is useful. People want to know where they can get it, and they want to know where to get it now, because in hours time they can't remember what it was called, never mind anything else. So yeah, because just the way we do our coaching, then we would provide feedback, and if there's any products we've discussed, we'll put it in there. And they're not always ones that, you know, often they're things that people can buy in high street, as you were saying about sodium, you know, SLS, non-foaming toothpaste. There's plenty you can buy over the counter without having to look for specialist products, although there's plenty of really good specialist products there as well.
Yeah, this is quite a recent one. Apple.
Oh, you were telling me about that. Yeah, the Sensi one. Sensi's one.
But it's Apple. It's quite good learning. People learn disabilities that people with autism, mint, that find mint too strong, or I think they got a kiddies version of it as well.
Yeah. We would always,
SLS free. It's very tasty.
I know we would always, I mean, the Aura Nurse one is our sort of go-to autism friendly one. And then we're going to have a little product comparison pile here. But there's Oraleave. I mean, there's so many.
There's plenty on the market.
Just in case anybody else is looking. You don't want to offend anybody if not having them.
Oh yeah. Well, I've mentioned Oraleave for the 360.
Oh, we're fine. Right. Right, okay, well, I'm just thinking to see what
I don't get commission, by the way. If you anyone's wondering if I get commission, I don't.
No, neither do I. It's perfectly all right. Let me see. Best time for mouth care we've covered. Oh, I know what. Have you got tips on how to remove somebody else's denture?
Right, okay. That was something that again is quite tricky. So removing somebody's denture, especially if it's a partial denture, so they've got the metal clasps, around possibly teeth that are a bit loose. It's like, oh my God, am I going to actually pull this tooth out? Do you know what? I can get somebody to remove their own denture rather than go in there.
Right. Okay.
They're so used to using it, even if someone's got dementia.
Yeah.
Yeah. Occasionally I have to go in there and remove it myself, but almost 9 times out of 10, I'll get them to remove their denture out. Or but yeah. So if you are removing it, you have to put your finger in their mouth basically for it. If it's got a clasp, you go around, you find where the clasp is, and obviously with a gloved hand, you click on the top of the clasp and click it down. But it can be, it can be not easy. So I would always try and prompt someone to take their own denture out. And the other thing also, Leigh, is putting the denture back in again can be equally painstaking. So if you've taken a full denture out, now you're trying to put the denture back in. What you can do is put the denture on the top of the lip, because it usually prompts them to open. Actually, when I'm talking about that as well, if you've got somebody that is not opening their mouth, you can. Oh yeah, I've got a denture too. So you're
not mine. I hasten to add.
So you wet the denture and you put it on the lip. Put the denture on the lip. Yeah, it's a response. And the other thing is, if they're not opening, you want them to brush their teeth, is you can put a little smear of toothpaste on their bottom lip. Or use the back of or use the back of a toothbrush, and try and get them to open. Well,
a little bit.
Yeah.
And I know we've talked in the past about finger guards and things like that. Do you find those are useful or not?
Yeah, I used to recommend the Bedi Shield. Oh my God, I get told off about, I've actually stopped, I've taken off my website. I get too many complaints about that.
Really?
So, okay, yeah, it's, yeah. No carer is going to use that. With putting their finger in their mouth, it's a psychological thing. So I've got there's a picture of my son on my presentation biting onto a toothbrush. So if you've got somebody that is a real clencher, or you can get them to bite the end of a toothbrush, so your hands aren't anywhere near the mouth. Or if you're brushing someone's teeth, again with mid stages of dementia, quite often you'll have somebody, you're brushing their teeth and they bite down. They think they've got food in their mouth. So what you would do, if you'd have another brush, always have 2 brushes around. So with the other toothbrush, then you brush the teeth.
Good. Yeah, that's a good tip. And again, it's not trying to just not get your fingers in the way. And we're all scared of being bitten. I mean, if anybody has been bitten, it's very painful if somebody clamps down. I once had a lady who had MS that went into spasm with a finger between the upper and lower molars. Yeah, and I mean, ultimately, she was far more upset than anybody else, but it was incredibly painful at the time. And it is, so you can understand people's wariness of putting fingers between teeth, but sometimes I find it's useful if you know that there's teeth missing. You can almost sort of get in where they're not going to be able to make actually contact. It's a bit like doing it with babies, but
but you see, you and I are quite used to putting our fingers in people's mouths, but when you're assisting someone and you are the carer, I wouldn't actually advise putting the fingers in the mouth, to be honest with you.
Do what you can as frequently.
Yeah, I'd veer against that.
Yeah,
safety first.
yeah, always. But in residential care, when people are in residential care, how do they access dental treatment? So, I mean, do GPs
difficulty?
Difficulty.
It's the biggest thing, and it's funny because when I first set out, so I was going into these homes, delivering these free training, and I don't know, I've probably done about 4 talks, and this care home said, "Oh, but we can't get a dentist in." It's ridiculous, of course, And oh my God, I literally spent the whole afternoon, because it was only care home down the road for me. I literally spent the whole afternoon phoning practices, trying to get, because they had this home, they wanted a dentist to look at this resident of theirs, because she was in pain, etc. So, and she couldn't go anywhere, she's bedridden. So I thought, oh, that's easy. We'll get domiciliary dentist to come out. And I struggled, community services, and yeah, it was just horrendous. It was, and that was a real eye opener. And that's, to be honest, that was probably the thing for me, was like, oh my God, if I'm finding it really difficult, it's going to be impossible for them. Because I was saying, oh yeah, I'm a hygienist, and we used to deliver domiciliary care, but we don't now, and that's basically all that ever happened. And even the community dental services was a nightmare. So it depends on what region you live in. So some are great, and some are absolute nightmare to try and either get a dentist, or even the community dental services in some regions. So I do empathise. So although it's being put on the CQC list, it can be
challenge to get people. And I'm just thinking that must mean that there's a whole portion of the population who, I'm just thinking the age that many of those people will be now, they have quite extensive restorative work. So they've got lots of fillings, partial dentures, and those are the ones that are high risk of root decay, and all those sorts of things, and yet nobody's actually monitoring them or maintaining them.
Well, that goes, yeah. The problem, it's not a problem, but the thing is, with these care homes, you've got large care homes. My dad's in a care home, 72 residents. Some of them's got an over 100 residents. And like I ask in every talk I give, I say to staff, when was the last time you called a dentist out? Because quite often it's like months and months and months ago, or longer. And you'd think, on the whole scheme of things, that they'd be phoning the dentist up every 30 seconds, because they come into care homes with existing problems. So that was something that baffled me as to why they weren't phoning dentists every 5 minutes with people with raging toothache and problems. And especially when I was screening people and lots of broken teeth, where teeth are so decayed, they've actually broken right off at gum level. Yeah. So you and we'd have raging toothache, but for the elderly, they don't. So that is possibly part of the reason it gets neglected as well. So as we get older, our teeth, all of us, our teeth become less sensitive with age, as the pulp chamber and blood supply gets smaller and the dentin gets thicker. We lose the blood, we lose sensation. So they don't have lots of residents with raging toothache and fat faces.
The one thing I would say, and I have suggested this to a lot of people who have a family member going into residential care, because they inform, the health and social services all know that this person is going into residential care, but quite often their dentist will not have been notified of that. Now, in my experience, if the dentist that they have been going to for 30 or 40 years knows that they've gone into residential care, they're more inclined then to maintain that contact in one form or another. So I think it is worth letting the dentist know that my mother or grandmother has gone into X residential care, and what is the mechanism for continuing dental treatment.
So yeah, these care homes are encouraged for residents to register with a dentist if they aren't already registered with a dentist. So if somebody's come into a home and they're registered with a dentist, then they keep that dentist. Yeah. So if not all residents are I was going to say housebound, then bedbound.
Yeah.
So if they
can go out. They are allowed to leave.
They are allowed to leave once in a while, although my dad isn't at the moment. So if they've got a dentist and they can go, then yeah, of course they have their checkups and their treatments as they would do. But if they haven't got a dentist, I think you'll find it even more of a problem to register with a dentist now, possibly. It all depends really on where you are and what kind of dentist. But to have a dentist come into a care home, yeah, there's a lot of dentists that don't, because it's time consuming, and you know, you need a big medical lots of medical equipment, about £2,000 worth of medical equipment to actually go into a home. So and they've got lots of complex, you know, medications, etc. So it's not always that straightforward. Yeah, unfortunately.
I mean, it
a
is
problem.
challenging treatment, and I think probably going forward, the next generation of residents are going to have more complex dental treatment, because we're going to have people that have implants and all sorts in there coming beyond. So I think that's going to get more interesting.
Yeah.
And people like yourself who are taking the time to train staff to actually help residents maintain their oral health, maintain their independence, maintain their personal hygiene. Because often I hear from people that they say, oh, I went to see Granny and her breath was foul, you know, and it's because that routine care is not, that sort of mouth hygiene is not going on a regular basis, which is really, really sad.
Yeah, and especially if somebody is in end of life care, you know, and they're close to them, it can be a bit off-putting. And sometimes, you know, families get involved in mouth care at end of life quite often.
Yeah, we did that with my mother-in-law at the end of life. I mean, I did her mouth care in the hospital, and it's actually, we built up quite a good relationship with the nurses, because they were very wary of going near her mouth. And actually it did, you could just, I mean, it was giving her relief and making her comfortable. And as you say, with any sort of palliative care, that's what it is about at that stage. You know, it's about making them comfortable and keeping their soft tissues lubricated, really, isn't it?
Yeah, definitely.
It's tough going. Is there anything, gracious me, we have covered a lot. Do you know that we've been chittering away here for an hour, my dear? We've been going well. We could go on for another hour, but I'm sure our ears will be bent. We'll have to have you back, definitely, if you'll come back and talk another time. One quick word about supplements in residential care. Is it something that we should be concerned about, or is it a priority thing that, you know, ultimately somebody needs the calories more than they need to be worrying about the amount of sugars that are in that supplement? They sit for hours.
Okay, so with it's why when we go into care homes for the elderly, we don't go into the diet aspect of it. Like I say, they come in with existing problems. You know, they've got little to look forward to, let's face it. And what they do look forward to is the social interaction of their coffees with lots of sugar in quite often, and juices and cakes and biscuits. And it's a really important social interaction. And it's something that we wouldn't interfere with. They are weighed quite often, quite regularly. So if somebody's losing weight, they're full of calories, you know, such as, you know, biscuits or all the supplements, which are quite high in calories. So it's not something that, again, learning disabilities is completely different. But for the elderly, we really concentrate on why plaque needs to be removed, and aspiration pneumonia, which I know that we haven't covered, but maybe I'll talk about it in the next.
Yes, that would be, particularly because it's been
our whole thing, our whole training and our whole presentation is all about aspiration pneumonia, inhaling that bacteria.
And it has been raised a lot in relation to COVID. Patients that are intubated hasn't it as well. So yes, there's definitely, I need another list. I need a list. That's what I'm doing. Name my lists. No, listen, Jane, that has been absolutely fantastic this evening. I have learned a lot. I always learn something when I'm talking to you anyway, but thank you so much, because there's whole aspects of this that we haven't touched on yet this evening. But I would encourage anybody that's listening, either now live or to the recording, please go and look at Jane's website. I'm going to put the links in the comments underneath this, because I find people come back when they look at this. If I look at this next week, I'll find there's a whole lot more people have gone and watched the recording, and those links are really, really useful. So if you've got anything you want to pop in there, Jane, let me know and I'll put them in. So I'll put your website to begin with, and then I know there's 1,001 other bits of interesting stuff from that. So thank you very, very much for joining me. It's been a really, really interesting talking.
Thanks for inviting me, Leigh.
I just love what you do. I think it's such an important aspect of oral health. It has such a huge impact on general health and well-being. These are people that are often not forgotten by those that care about them, but you know, they're sort of, well, they're you know, they're old, it doesn't really matter as much. And yet, as you say, that little cup of tea, being able to swallow, being able to sort of enjoy the taste of things, which is one of the big problems if your mouth is dry, is just so important to quality of life. And often we don't think about quality of life in relation to our oral health, and it's such a key part of our overall well-being and health, isn't it, really?
Yeah, definitely.
So thank you very much indeed. We will toddle off. I will be in touch, and have a great rest of the evening. What Thursday? I don't know about you. I wonder what day of the week it is sometimes. I'm at that stage, but soon we will know what day's a Monday, you know, hopefully. Listen, thank you ever so much. Thanks everybody who joined us, and we will see you again next week. Thank you. Bye.
Bye.